Welcome back. So many women win the fight of their life against breast and ovarian cancer. One topic that's not always discussed, though, is how the body changes following chemotherapy, particularly your pelvic health. Dr. Erica Stockwell from Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center is here today to shed light on this important topic. And you also have some exciting news about a new laser therapy treatment that can help women who have undergone early menopause as a result of chemotherapy.
That's right.
Welcome, doctor. How are you?
Good. Thank you for having me here. Good to be here.
Thank you so much. Well, I love that we're addressing this topic. It is a fairly intimate topic.
Yes.
But it affects women so deeply. So tell me about the women you treat.
Yeah, so the women that we treat with this laser therapy, and I'll get more into it, but basically, we typically think about women who go through menopause as being in the late 40s, early 50s. Average age of menopause in the U.S. is about age 51 or 52. But what we don't highlight, and what's actually lesser known, and specifically this month we want to talk about those women who have gone through chemotherapy. So this month, with being Breast Cancer Awareness Month, we want to talk about those women who have gone through chemotherapy and actually are affected by the same symptoms of menopause as those women who go through menopause naturally.
Yeah, it's very interesting. So as a result of chemotherapy, it can often trigger an early menopause in a woman.
That's correct. Yep.
Yes.
So chemotherapy can actually damage susceptible organs, so one of them being the ovary, and it can actually cause early onset of menopausal symptoms.
Interesting. Let's talk about menopausal symptoms.
Yeah.
So, you know, it seems like a lot to deal with, frankly. If you're coming out of chemotherapy, I know a lot of people are dealing with loss of hair, loss of weight, loss of energy.
Yeah.
It affects the skin, it affects the nails, and there's just this period where you're trying to rebuild your body.
Exactly.
It also affects your pelvic health going through chemotherapy. Tell me how it affects.
Yeah, and it's important that we're talking about this topic and that we're bringing it up because, like I said, not as much is known about this as far as how these women are affected after they go through chemotherapy. Like you said, women just want to rebuild their lives and feel normal again. But those who are affected by the chemotherapy actually experience pelvic health issues as well as those symptoms of other symptoms that we typically think about with menopause, including the hot flashes, the night sweats, but they actually can also experience vaginal dryness, vaginal itching, actually painful intercourse, frequent recurrent bladder infections. So these are all some of the issues that can affect these women and are symptoms of what we call vaginal atrophy, which happens with a decline in estrogen over time.
Vaginal atrophy. So this is something that it's a very intimate topic to talk about, but if it is happening to you, if you're experiencing it, my goodness, you're going to know it.
Exactly.
Am I right?
Yes.
So this makes a woman very uncomfortable. It's something that is a little bit hard for a doctor to diagnose. Am I right?
Yeah, it's there are some signs that we can see on physical exam, but it's also a lot based off of symptoms. So a lot of women, it's kind of considered taboo to bring it up to the doctor. It's, like you said, a very intimate topic. A lot of women think, well, maybe I'm the only one experiencing this. Some women think, well, everybody experiences this, so it's just something I have to suffer through, but it's not true. So almost 40% of women going through menopause and also those after chemotherapy actually experience these symptoms. And it's important to bring it up to your doctor because there are treatment options available.
Excellent, and we're going to talk about those treatment options, but what I hear you saying that I think is so important is you're telling women, trust your instincts. If you're experiencing symptoms of severe dryness, discomfort, these are things that happen to a lot of women, and bring it up with your doctor.
Yes.
Yes. Okay, let's talk now about treatment. If a woman comes to you, let's say post-chemotherapy, and she is now experiencing a lot of discomfort and dryness in her pelvic region, what what can you do?
Yeah. Well, traditionally there are a handful of creams and lubrications or gel out there. There are also for women just going through menopause hormone replacement options in pill form to help replace some of the estrogen that's lost over time.
Okay.
However, women going through chemotherapy for breast cancer and for those cancers that are hormone responsive, they're not able to take hormone replacement therapy. So the hormone replacement therapy can actually stimulate breast cancer cells, and so of course we want to avoid that. There is a newer technology out. It's called MonaLisa, and it's something that's offered at my clinic here, and it's an FDA-approved vaginal laser technology. It's actually newer here in the U.S., but it's been used in Europe for many years. And actually here in the U.S., it's being used for dermatology and plastic surgery, but more recently we're using now to treat vaginal atrophy.
Interesting, doctor. We have just under 45 seconds, and I really want you to tell me about some of the results.
Yeah.
Tell me a little bit about the process of being treated with MonaLisa Touch and the positive results that you've seen.
Perfect. Well, the first thing to do is call the clinic and get an appointment set up. The treatments is a total of 3 treatments. They're each 6 weeks apart. They last about only 5 minutes. No anesthesia is required, done right there in the clinic. Very well tolerated, very painless procedure, and women can feel the effects, within 12 hours of the very first procedure.
Oh, wow.
But we do recommend the total 3 treatments.
Interesting. And can you explain to me a little bit about how the device works?
Yeah. So the laser, what it does is it actually stimulates the cells of the vagina, and it helps to rejuvenate and rebuild those cells and increases blood flow to the cells. And so there's been a lot of studies actually looking at the cells on a slide, and you can actually see how the cells thicken up over time. And so this helps out with all those issues with burning and painful intercourse, itching, things like that.
It's an amazing technology.
Yeah.
I'm glad women have access to it. Thank you so much for sharing.
Thank you for having me here.
To find out more about the MonaLisa Touch, call the number or head to the website on your screen. Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center is on Sunset Road near Fort Apache. You can also follow them on Facebook and Twitter. And